afternoon, everyone. I'd like to welcome everyone to the Back and Neck Center webinar. We are so glad that you joined us today, and we will get started in just a few minutes. Well, hi, everyone. I'm Mary Wiley with Baylor Scott & White Health, and I'm happy to welcome you to today's Back and Neck Center webinar. I will be your facilitator for today's session. We are so pleased that you have joined us for what promises to be a very informative session. You will learn how you can access care very quickly and conveniently through video visits. And most of the time, these visits can be done the very next day. So we have a distinguished group of clinicians who are participating as our panelists for today. You can see their pictures up on the screen. I'd like to go ahead and introduce them in a minute. Our panelists will be providing an overview of the Baylor Scott & White Back and Neck Center from their perspective, and then we'll open it up for questions and answers. And please remember, you can enter questions in the Questions tab on your webinar dashboard at any time during this presentation. And I can see we already have some questions, so thank you. Of special note, we do not provide any pharmaceutical management within this program, so we won't be able to answer those questions. So before we begin, please allow me to briefly introduce our panel. And for a more detailed bio for each panel member, you can click on the speaker bio in the right-hand corner of your screen. So now for our 5 panelists. Brandy Morris. Brandy is one of our nurse navigators at the Back and Neck Center. Krista Rohde, she is our physician assistant. And Dr. Jeremy Denning, who is a board certified and fellowship trained neurosurgeon. And then Dr. Timothy Clark, and Dr. Clark is a clinical psychologist and a neuropsychologist. And then Dr. Radhika Ravula. Dr. Ravula is one of our pain management physicians and our anesthesiologist specialist. So thank you, panel, for participating today. And thank all of you again for joining in to this webinar. According to the National Institute of Health, 80% of Americans will experience back pain, and 70% of Americans will experience neck pain. So it's likely that many of you all are suffering right now, or you know somebody that suffers with back and neck pain. This type of pain can interfere with our daily lives and our activities and diminish one's quality of life. Many patients will go from place to place trying to get answers, trying to find relief. The Back and Neck Center is designed to be a one-stop shop. And our goal with this center is to provide you with all the knowledge you need to take charge of your health and make sound decisions. And that will get you back to feeling better soon. The Back and Neck Center currently offers services in North Texas. So if you are looking for treatment for back and neck pain in Central Texas or Austin, please visit the bswhealth.com/spine to find a provider near you. And that link will be in the chat box for you to see. So now let's find out how quick and easy it is to access care through the Baylor Scott & White Back and Neck Center.
The Baylor Scott & White Back and Neck Center provides a quick, convenient way for you to access expert neurological and orthopedic care close to home. From setting up an initial virtual appointment to discussing the least invasive treatment options, Our dedicated team are ready to navigate you every step of the way.
We leverage virtual visits where patients are seen quickly, evaluated quickly, and then we make a streamlined treatment plan specifically tailored for their needs, be physical therapy, pain management, or even surgery if needed.
The Back and Neck Center is actually a virtual clinic, so patients can access the clinic from the comfort of their homes.
Patients are not required to have referrals. They can easily get our information off of our website.
They can be referred from their primary care doctor, from the emergency room, or even a self-referral.
The Back and Neck Center team is a comprehensive team of nurse practitioners, nurse navigators, orthopedic surgeons, neurosurgeons, pain management physicians, and physical therapists that are all dedicated to serving the needs of our patients. We look forward to working with you to address your health concerns at the Baylor Scott & White Back and Neck Center.
Want answers to. So let's start with you, Dr. Denning. Thinking about prevention here, and I know you are conservative in your approach, why do you think back and neck pain issues are so prevalent, and what can we do to prevent them?
Thank you, Mary. Well, first of all, the spine, as we know, it supports, in the case of the neck, it supports our head, and in the case of the lower back, supports our upper body weight. And this puts a lot of stress and strain on these areas. And you combine this with overuse, improper body mechanics, injuries, fractures, and certain genetic factors, and just aging itself, where our discs and joints lose some of the water content and elasticity over time. All of this can lead to problems in our back and neck and contributes to these problems. As far as ways to prevent these types of problems and injuries, one of the first things that one can do is control their body weight, because each extra pound puts even more stress on our musculoskeletal system. And this over time can add stress to the joints in our neck and lower back. Also, just engaging in regular exercise helps strengthen our muscles that support our spine. Maintaining good posture, we've always been told, even when we were young, sit up straight, use good posture. But it's really important because this in and of itself also strengthens the muscles that support our back and keeps our back and neck in a neutral position. It's important to note that, the things that we do every day, whether it's looking down at a cell phone, texting, looking down at a computer, all of these things add up over time to just increase wear and tear and stress in the joints of our spine. Another one is prolonged sitting, trying to avoid this because it puts more pressure in our lumbar area. And one of the final things that I mentioned, which we know is not great for us at all, is avoiding smoking. And there are numerous studies that show that those who do smoke have a higher incidence of spine problems. So these are some sort of good starters, I think, to prevent problems in our back and neck.
Thank you, Dr. Denning. So let's move to Krista. Krista, can you describe the inspiration for the Back and Neck Center's unique approach?
Thanks, Mary. So we recognize that it was very difficult for patients to navigate the process of being evaluated for neck and back issues, as well as getting into a neurosurgeon and having surgery. We wanted to make it easier for patients. So this program was developed as a one-stop shop to get quick care. We also have frequently able to get patients within a day into an appointment. And we do this to evaluate them and get them to the right people in a timely manner. Of note, there's nothing like this in the entire country. So we've been building this as a way that this could potentially launch care for the future as well.
Thank you, Krista. The Back and Neck Center team can customize a plan for each individual patient. Can you tell us a little bit more about what that might look like?
Absolutely. So when a patient starts their appointment, myself and my partner Elizabeth will go through a history of when their back pain started or neck pain started. We'll ask them a bunch of routine questions. If they've already had imaging, we will review that with them. And if they have not, we will talk about potential options for imaging to be done. And once we get a comprehensive history on the patient, we talk one-on-one and we discuss what a great plan will be for their neck or back pain, whether it be imaging or referrals needed from there. So it's customized to each individual patient depending on what type of pain they're having, what they've had done in the past, and what they need done in the future.
Okay, thank you, Krista. The process for patients visiting the Back and Neck Center begins with a video visit, and it empowers patients to get the care when it's extremely convenient right out of their home. Brandy, can you please talk us through kind of how this might work?
Yes, thank you, Mary, for the introduction, and hello to everyone that's joining us today. Again, my name is Brandy, and I'm one of the nurse navigators here with the Back and Neck Center. So the process for scheduling an appointment with us is very simple. We can be reached by phone, email, you can chat with us online, and you also have the option to self-schedule an appointment online. The Back and Neck Center does not require a referral. We have a team of nurse navigators that are available to speak with you. We're going to ask you a few screening questions. We will verify your insurance and then get you scheduled for the video visit. The Back and Neck Center usually offers next day appointments because we understand that many of our patients are in pain and they need help quickly. Prior to your video visit, a nurse navigator is going to contact you to ensure that you're prepared for your video visit. After your video evaluation, you will be referred on to a provider that best fits your needs. So that could be a specialist, spine specialist, pain management doctor, neurosurgeon, maybe physical therapy, and they may require imaging such as an MRI. And so this is where the nurse navigator works on the patient's behalf. So we're going to work on the back end to ensure continuity of care is established. We will proactively communicate with your new referred providers and their facilities to get our patients scheduled and scheduled quickly, okay? We're going to follow you and guide you throughout this entire process. During your treatment, we're going to make follow-up calls to you. We're going to check on your progress, making sure that this is the best treatment plan for you. Also, we're going to act as another clinical resource for you. So that means educating you, answering any questions or concerns that you may have. So during your journey with the Back and Neck Center, you will never be alone. You will always have a nurse navigator here to assist you throughout the entire process.
Thank you, Brandy. And one of the features that really makes this program so special is having a nurse navigator and somebody that walks you through your healthcare journey and assists you with scheduling and answering questions and coordinating all the care. And so, Brandy, can you talk a little bit about how you advocate for patients and what the nurse navigator role really is?
Yes. And so as nurses, we're at the forefront of patient advocacy. So we understand how to be compassionate, how to be empathetic. Oftentimes, we are the professionals that know the patients the best. We are the voice for our patients. So people come to us, they're in dire need of immediate treatment for their back or neck conditions. And the way that we advocate for the patient, excuse me, is by ensuring that they're seen by the specialist in much quicker time frames than they normally would. So in this environment, we collaborate with other providers, and communication is crucial for positive patient outcomes. So, for example, an initial appointment with a neurosurgeon can be, several months wait time. At the Back and Neck Center, you'll have a nurse navigator that works behind the scenes to make sure that the patients are seen quickly. And if that means contacting a provider's office to let them know, hey, this patient is in real need of care, we're going to act as the voice for you, making sure that the care is provided promptly. Okay. So this is a benefit to the patient. It improves patient experiences because with a nurse navigator acting very quickly, the patient is able to experience results even faster, able to move and function and get back to their normal lives pain-free. Again, the role of the navigator is a care coordinator. We understand that there are many healthcare providers available out here, but getting access to them and really understanding your plan of care can be very tricky and overwhelming for patients. So we're the experts in this domain, and we're here to help guide the patient so that they don't end up lost while trying to navigate independently.
Thank you, Brandy. All right, as we've already heard, there can be many factors that contribute to chronic neck and back pain. This may mean the condition requires a multidisciplinary team of experts to treat the condition. Our center includes case reviews with a multitude of clinicians. The Baylor Scott and White Health Back and Neck Center offers a range of comprehensive care from non-surgical and minimally invasive options to traditional surgery. So Krista, please tell us a little bit more about non-surgical options that are available.
Absolutely. So a lot of times when we see patients and we assess their neck pain or back pain, how long it's been going on, our favorite first option is to get patients in with a physical therapist. A physical therapy team is great for neck and back issues. They can work on stretching, they can work on strengthening, they can tailor their plans to the specific patient, as well as I tell people they can get a home exercise program, things that they can continue every day at home to work on their back. And this is really one of my favorite non-surgical options for patients. And then, you know, if we need to go a little further than physical therapy, our next line would be pain management. And we have wonderful Dr. Ravula who helps us out with a lot of our patients.
Thank you, Krista. So let's go to Dr. Ravula now. And can you explain why, if the first line measures like physical therapy, like Krista just talked about, aren't sufficient, why would they maybe need to seek out pain management? And what would this actually entail?
Yes, the goal of a pain management clinic is to help patients cope with their pain and to improve their quality of life. So when we get a referral, we try to schedule an appointment as soon as possible. And when we see them in the clinic, we start off with history and we also review their scans. The first step is to establish a diagnosis. And once we have a diagnosis, we have several modalities to help patients cope with their pain. It could be medications, it could be injections, it could be a combination of both. And we have some patients who are struggling to get through physical therapy because they are in pain, and this can cause a setback. So we can prescribe pain medications to get them through physical therapy. And if that doesn't help them, then we can evaluate the scans to see if injections would help them. There are many kind of injections that pain management physicians do. Like, for example, if a patient has predominantly nerve pain, sciatica, where they have pain in their legs, numbness and tingling, we may start off with an epidural steroid injection. If a patient has mainly back pain and their presentation is more along the line of arthritis of the spinal joints, we may try arthritis-specific injections. And these injections can give them relief for periods of time, depending on their condition. And if what we do does not help the patients enough to give them back their quality of life, then they go to the spine surgeons to see if there's something definitive that can be done. And we also work with a very good psychologist, Dr. Clark. And sometimes our patients who are on pain medications and injections are still struggling to cope with their condition, or they may have insomnia. stressors, and he plays a very vital role in providing modalities that help them cope further.
Thank you, Dr. Ravula, for setting up my next question. So, Dr. Clark, can you please explain a little bit more about your role and how you help the patients with back and neck pain?
Thank you very much. Pain happens to people in their lives. That means that it affects your ability, how you see yourself, what you can do, your relationships, but it also affects your mood. Part of the problem with pain is it's like an alarm. It's going all the time. And when an alarm is going off, it's hard to focus on our lives, and we're left tensed and more stressed. What also happens is when we have pain that keeps going, it really can get to our head, and we begin thinking, am I ever going to get better? I can handle this today, but what's going to happen tomorrow? Will I lose my job? All these thoughts come along and they add to that sense of stress and wear that happens with that. And what's interesting is biologically that depression, stress, and anxiety travel in similar pathways. So what happens is that our thoughts, our emotions, our actions actually can turn up the volume on pain. But if we learn how to do something different, we can learn to turn that volume down. So we work with people on learning how to react to their pain differently, how to shift focus, how to calm the nervous system that's gotten wired because of all the stress of pain in life. And so what we do then is we'll use mindfulness or other techniques. And very often people will find ways to do that so that they can live more fully, regain focus on what's really important in their life, at the same time suffering less. And that's kind of my focus.
Thank you, Dr. Clark. Very interesting. So, Dr. Denning, patients are often referred to you if other treatments are not working and a patient's condition is serious enough to actually consider surgery. Can you talk to us about the various surgical options?
Sure. So first of all, we try and exhaust conservative treatment first, because a lot of times this works for most patients that we see. But if these modalities are not working for them, then we will consider surgery to help them. Unfortunately, when most people hear the word spine surgery, they cringe. I see patients every day, and just the thought of it makes them very anxious and concerned. And I would be too if I wasn't in the medical field. Fortunately, today, we have more and better options than we had in the past. And in fact, when I started practicing in 2006 to today, we've had many improvements in our spine implants that we use during surgery. There's artificial disc options in some cases, advances in the equipment that we use in the operating room that help us perform these surgeries in a less invasive manner, which leads to basically a quicker recovery, less complications than what was available in the past. Again, most of the time, conservative treatment does work for most patients, but we have better options now for surgery if it becomes necessary.
Okay. So what happens if the patient has already gone to a surgeon and maybe that surgeon had recommended surgery? Does the back and neck program have anything like a second opinion program attached to it?
Absolutely. Typically, when someone has seen another physician, surgeon, and have been recommended surgery, that there's a lot of questions that come into their mind. Is this the right move? Perhaps I should get another opinion. And we think this is a very fruitful endeavor. There are a lot of questions. Sometimes they leave that office and they forget a lot of what they were told. But we do offer this at the Back and Neck Center. And a lot of the questions are, do you agree with this approach? Or if I do need surgery, is there perhaps a better approach for my particular problem? And so we provide this at the center, and I think it's a valuable option for patients. In fact, one of the first patients that I took care of at the Back and Neck Center had seen 3 other surgeons and had been recommended 2 or 3 different surgeries. And ultimately, we tailored an operation for him, and we're fortunate to have been able to take care of him.
Thank you, Dr. Denning. So going back to the uniqueness of the program, Krista, how does the Back and Neck Center's sort of multidisciplinary approach, and you can see that, you know, with all of our speakers today, how does that differ from the norm?
Yes, absolutely. So, as everybody touched on, they need to consider a multi-team approach to back pain. So, our center has recognized that everybody falls into one place to get those referrals. So, from us starting with the referral, our wonderful nurse navigators who get the patients in and help them guide through their journey, as well as our myself and Elizabeth who can get through their history, and then referring them out to physical therapy, pain management, neurosurgeons. We also have the ability, once we order imaging, to touch base with those patients and go over their imaging, talk them through it, and kind of describe what's going on that they may not have had that chance in the past, as opposed to just reading a report. So it's just combining all the things that patients need into one center.
Okay, thank you, Krista. So the next part, and I want to thank you for answering those questions. Now we'll kind of go to the questions that are in our chat box, and I'll try to read some of these questions and see if I can get some of the panelists to answer your questions. Okay, so the first one that I'm looking at is just, it says, I am having problems with my balance. Is the Back and Neck Center a place where I need to go? Who would like to take that question? Somebody.
I can take it. You know, balance, there are different reasons that someone could have difficulty with their balance. It could be, you know, something going on in their chemistries and their blood work, et cetera, that could be contributing to that. But from a spine standpoint, you know, you can have issues in the cervical spine or even thoracic spine that could affect your balance. And, you know, if you're having difficulty with your gait, finding that you could start, you know, using devices to help assist you with your balance, that may be a point to have that looked at. And so while I can't say specifically that that is a spine problem, it certainly could be, and you know, we would work that up and explore that.
Okay, thank you, Dr. Deneen. Here's another question for the group. How do I know if and when my back pain is serious? That may be another one for you, Dr. Deneen.
Well, I think if it's like severe, disabling pain, that would be obviously a concern. There are some red flags, such as severe pain at night, severe pain associated with fever, neurologic symptoms. Not always is it something super serious, but like, for example, if you're having weakness in the leg or the foot or the upper extremities, numbness, tingling, things like that, that could imply some sort of spinal cord or nerve root compression, and you'd want to have that evaluated. But certainly severe pain and neurologic symptoms would be something to have that explored.
Okay. This question is more about the neck, and the person is asking, is neck tightness and the pain and the cracking around the neck, could that be just arthritis? Dr. Ravula, do you want to address that?
Sure, I can take that. Yes, when patients have arthritic changes in the cervical spine, many of them, just from the friction and rubbing of the joints, will complain of hearing clicking, and their muscles can be tense. And they, when we evaluate them, we definitely will see if they will benefit from injections of the spinal joints. And those can help with the muscle spasms as well. And it can also increase, more importantly, with the cervical injections, it also tends to increase the range of motion. So people who have difficulty when they're driving, especially when they're turning from side to side, if they're having difficulty, they can notice an improvement in that symptom from injections and physical therapy.
All right, another question, and I know Dr. Denning said that sitting too long can cause your back to hurt, but the other question is there a way that I should be sleeping to avoid lower back pain? Is there a certain way that I should sleep? Krista, I see you smiling. Or Dr. Denning, go ahead.
Yeah, in general, sleeping on your back is typically better because it maintains more of a neutral spinal alignment. But at the end of the day, our bodies kind of tell us most of the time what's most comfortable, and typically if it's uncomfortable, it's probably not ideal. So, but in general, sleeping on one's back or side is typically a little more ideal than prone on our stomachs. But I toss and turn all night, and so I just try to get in a comfortable position. And in general, I think listening to your body is typically works out for most people.
Thank you, Dr. Denny. The next question from the audience is, how do you tell the difference between lower back pain due to muscle strain versus neuropathy?
Okay, I can take that.
Oh, go ahead.
Typically, if it's muscle strain or sprain, they'll feel it in the back. And so that's more of a muscle condition. With neuropathy, most often it's the small nerves that are affected. So the way a patient typically describes a neuropathic pain is, I feel burning or numbness or tingling in my feet. So sharp electrical numbness, tingling, burning, those are signs of nerve irritation. And they tend to feel it more like in their peripheries, like whether it's their feet or the legs, whereas muscles, they feel it more in the back.
Thank you. All right, this next question is just someone that needs help for their back trouble. They have a rod and 6 screws and hardware in their back already, and their back is still in pain. So the question is, what do you do when you already have hardware in your back and you've already gone through some surgeries? Is there such a thing as, a revision? Is there something that can be done for someone like that?
Perhaps I can start, and then Dr. Ravila could chime in at the end. But for someone who's had previous surgery where they've had instrumentation infusion, one of the first things we want to look at is there any loosening of the hardware or any problems with the hardware? Assuming that there is none of those issues ongoing, we want to look at levels adjacent to their surgery, because often there'll be some degenerative changes at the level above or below, or even sometimes rarely above and below. And sometimes, not infrequently, you can see some subtle changes early, and it's just over time, as time goes on, it becomes more clear that may be what's causing their problem. But assuming that you work this up with imaging and you don't see a clear source of their pain, often, again, this is a team approach. And so this is where we explore pain management options. And that might be injections. It might be spinal cord stimulator trials. And I can let Dr. Ravila comment on that. But we would basically get imaging and try to rule out structural problems, but would try to address it from all different angles.
Sure. Just continuing along that. Yes, if I happen to see the patient before they see a spine surgeon, I definitely will suggest that they go see either their surgeon or get a second opinion to make sure it's not levels above and below or something to do with loosening of the hardware. So if the surgeon has ruled out all of those factors, then we try conservative measures, which can be injections. And some patients tend to have a lot of scar tissue from their previous surgery, which irritates the nerves, which may not really require another surgery, but nevertheless, they have pain. And those patients can be good candidates for the spinal cord stimulator, which is also known as the pain pacemaker, which is a mechanical device. And that device has come a long way. And it's not for everyone, but for people that it does help, the difference can be night and day. And there's a trial before the implant. And with the trial, all we're doing is placing electrodes in the epidural space close to the nerves. And they are connected on the outside with a generator. And what it's supposed to do is when you turn it on, it masks the transmission of pain signals. So it's essentially an internalized TENS unit. So we do evaluate to see if they will benefit from that.
Okay, thank you, Dr. Ravula. The next question is around steroid usage. And I think the first question is, can you use steroids for back pain?
Yes. So for most of the injections that we do in the pain clinic, we do steroids. And because we are targeting the area that's hurting, we don't need as much of a high dosage as a patient would take orally, for example. And we do also pay attention to how much steroid we are injecting into the patient. So typically we don't do more than 3 to 4 injections in a year. And if a patient has diabetes, then we're a little bit more cautious. We have them monitor their blood sugar levels more closely. And if a diabetic patient shows up for an injection, we definitely check their blood sugar even before we inject them. And we advise them that for the next week, it could go up a little bit and they need to place some close attention on that. But yes, steroids can be given and we stay within a safe limit, which is typically no more than 3 to 4 injections in a year.
Okay, thank you, Dr. Ravula. And one other question is actually around acupuncture and whether or not that's recommended for back pain, back and neck pain. Do you have any comments or thoughts on some of the, other types of procedures out there?
Sure, I can take that. We do not offer acupuncture in the center, but for patients who have stressors, muscle stress, it can help. They do have to go through multiple sessions to see if it does help them. And, one of the things it does is it increases your endogenous good hormones like endorphins, and it can help cope with the pain and release muscle tension. So I'm not at all opposed to patients wanting to try that. It'll be a good adjunct, and we advise that they find a good acupuncturist and try it.
Thank you, Dr. Ravula. A lot of questions coming in now. Another question was, let's see, is burning a nerve to stop pain acceptable? Do you know, can you speak to that?
Yes. So for certain conditions, yes, we do burn the nerves to have them more sustained pain relief. Like one example is patients who have pain coming from spinal arthritis. So for the spinal arthritis, typically what we do is a diagnostic test first, which is just injecting numbing medicine around the nerves that carry pain sensations from the joints. So if we do the diagnostic test, we follow up with the patient to see how they responded. If they get very good pain relief, but it's only short lasting, then we typically repeat the diagnostic test one more time. So if a patient has had 2 diagnostic tests with significant but only temporary improvement in pain, then we do the burning, which is basically cauterizing those nerve fibers through the needle by applying heat to the tip of the needle. And that can make the relief last from 6 months, sometimes to a year. I mean, the outer fibers regenerate, so it's not permanent, but it can give them sustained pain relief for a long period of time, some 6 months, some even up to 2 years. But there are certain nerves that can be cauterized and some cannot. Like, for example, the nerves going down the leg, the sciatic nerves, we cannot burn them because they are important for feeling and walking.
Okay, thank you very much. Next question is basically, do you handle curvature of the spine issues? This has been exacerbated since I am getting older and body weight has changed. So anybody would like to speak about curvature of the spine? Perhaps Dr. Denning?
Sure. So absolutely, we deal with this. When people hear the word scoliosis, they think adolescents, kids, because there's that condition. But there's also a degenerative scoliosis that either presents later in life as our discs in our lumbar spine collapse more on one side and it starts to cause a deformity or a curvature of the spine. Or it might be someone who had a mild scoliosis when they were young, and just over time, as our discs start to wear down in the lower back primarily, it can cause the curve to start to accentuate over time. And so, again, we evaluate you as the patient, how your quality of life is currently, and are there things that we can do to improve on that, whether it's strengthening with physical therapy to increase support to your back. If it's pain, is there a pain management option for you? And then certainly, surgery would be sort of the last result or option that you would want to entertain. But everyone's kind of different, and we sort of tailor treatment options according to your need. But we absolutely evaluate and treat patients with spinal deformities and curvatures.
Okay. Thank you. The next question is more around the physical therapy component. I know we don't have a physical therapist on here, but I know we work with them all the time. Are there recommended exercises available for lower back pain? And I know there are. Does one of the clinicians want to speak about that and how they might find those?
I can touch on that, Mary. Yes, there are definitely exercises that target the neck and the lower back. A good place would just be to go online, and there's a lot of good physical therapy sites that link to programs. So if you were to look up lower back pain exercises or neck pain exercises, you can find those from reputable therapy programs that you can do at home.
Thank you, Krista. And we partner with, the Baylor Institute of Rehab, and we also partner with other groups for that as well. So one of the questions is just that came in was, I'm getting an injection to my lumbar area due to severe pain. What does this shot actually do for me?
Okay, so let's say we're doing a lumbar epidural steroid injection for low back pain and leg pain. So the injection itself has two components. One is local anesthetic mixed with a steroid. So the local anesthetic will give some immediate but temporary improvement in pain. The steroid is what is an anti-inflammatory. It is the most potent anti-inflammatory. So the hope is when the inflammation goes down, the swelling around that nerve goes down, the nerve has a little bit more room to breathe, and that will help the pain condition. The steroid does not do anything to correct a disc herniation or correct any spinal deformity. It is basically an anti-inflammatory. So what it corrects is inflammation and swelling around the structures.
Thank you. Can a lower back pain cause knee buckling and difficulty in walking?
I can take that one. So absolutely. It could be that the pain is so significant that it causes your legs to just go out from under you, just because of the pain. And the other possibility also is if there's compression of a nerve root to the leg muscle, that pain and that compression of the nerve root could cause the leg to weaken or the muscle to weaken, causing your legs to buckle. So frequently you'll see, I'll see patients in clinic and they'll say, and it doesn't have to be all the time. It can be intermittent. It could be that, I was walking down the sidewalk and I all of a sudden got this intense pain and my right leg gave out on me. That's a frequent complaint that I will hear in the office. So it absolutely could contribute to that or cause that.
And Dr. Denning, could you speak to just the latest type of minimally invasive techniques, new types of procedure, imaging, things that are kind of advancements that are out there today?
Sure. So I can just tell you that 2006, again, when I started practicing, we used a lot of X-ray in surgery. There was new technology that was being worked on for navigation, basically like GPS for the spine, so that any instrument that we used would have little electrodes that we could look at a screen and it would tell us exactly where we were on the patient's spine. That technology and iterations of that technology has improved to the point that now I never do a surgery without that technology. And so it's made placing, whether it's screws or navigating around the spine during surgery, just safer and more accurate. And also, because we don't have to expose so much of the spine to see what we're doing, we can do surgeries through little tubes that before would require a big opening in the back. So, and what that translates to is clearly lower risk of infection, less blood loss, less collateral tissue damage, and just better, quicker recovery for the patient. So there's a lot of things, and you know, things are continuing to improve. So I think we're in an exciting time, and certainly in spine surgery, where the outcomes have definitely improved.
Thank you very much. Lots of questions still coming in, so I'll try to get to quite a few more before we need to sign off. But the next question is, if I have back pain and hip pain, are they independent conditions or could they be related?
I can take that. Well, they could be independent or they could be related. So a lot of times pinched nerves in the back can cause pain that radiate from the back to the hip to the leg. And arthritis in the hip joint can cause pain in the hip. One of the factors that can differentiate is, of course, we first get diagnostic x-rays or MRIs imaging to see what's going on in the back and what's going on in the hip. Many patients with hip arthritis tend to feel pain in the groin, whereas pain that's radiating from the back typically tends to be in the back or going on the side or to the leg. But diagnostic testing, good physical examination will help us differentiate the two.
Thank you very much. We have someone that wants to know if we offer biofeedback and whether or not that would actually help pain.
Obviously, yes, we can offer biofeedback. Biofeedback is using technology to give us feedback on what the body's doing. It can be helpful for learning different techniques for lowering muscle tension, for changing kind of how we are reacting to the pain, to giving us more room to move in our lives. And so it is one of the techniques that we can use to help patients. And we do provide that.
Thank you, Dr. Clark. Okay, can a slipped disc get worse over time? And maybe we could explain what that actually means, a slipped disc.
I can try to tackle that one. It certainly could get worse over time. So a slipped disc or a herniated disc or a disc protrusion, basically the cartilage that acts to cushion our vertebrae. As we all age and we all undergo this process, the cartilage, the water content in the disc starts to decrease and the discs become a little weaker. The outer covering of that disc is a very strong fibrous network called the annulus, and sometimes you'll get a tear of that, and the inner nuclear or gelatinous part of the disc can protrude through that. And that's typically what people refer to as a slipped disc. Sometimes that slipped disc just causes back pain. If it's bad enough and starts to compress the nerve, it can cause back and leg pain or arm pain, depending on where in the spine it's located. And that can worsen over time. However, a lot of times it can actually improve over time, meaning that you could have a herniated disc And that's why, again, trying conservative modalities first, if you're not having severe weakness or something like that, a lot of times the disc can shrink a little bit. So while it can certainly worsen over time, there are cases where it actually does improve, and the patient can sort of get through that episode.
Thank you. Okay, here's a question. The attendant says, I am 72, experiencing very bad sciatica pain since May. And this person has tried physical therapy, acupuncture, stretching, ibuprofen. Should I go to a neurosurgeon or a spine surgeon for an evaluation? So I might turn that over to Brandy, because I know she's kind of the front line here that deals with a lot of people that don't really know where to go, where to start. Brandy, would you be able to address that question?
Sure. So when the patients contact us, we're going to do a brief just screening with the patient, initial screening, just to determine the type of pain it is that they're having, the quality of the pain, and just to determine whether or not they're a good fit for the program. In the event that they are, again, they will be scheduled usually the next day with one of our advanced practice providers. That's a nurse practitioner or the PA. And then from there, based off of that evaluation, then they'll be referred on to whatever specialist best fits their needs. So again, that could be, physical therapist, spine specialist, neurosurgeon, and so on and so on. So it's really, at that point, it's the nurse practitioner or the PA that's going to kind of evaluate and determine what is the best route for the patient.
Thank you. All right, let's take a couple more. I have cervical stenosis and MS. I am in PT. I saw a pain management doctor twice before he moved away, and was told if PT doesn't help enough, surgery is the only option. Would you be able to revisit this pain? Somebody like that, Brandy, be able to come into the back and neck center and be triaged effectively?
Yes, they certainly would. We do accept second opinions, and we'd be more than happy to, even just take a look at the patient's medical records and refer them over to one of our advanced practice providers, and then have them determine whether or not, this patient can be evaluated or just needs to move on with the process of a virtual video visit. So.
Thank you. And then Dr. Denning, this might be a question for you. Can you expand on diagnostic imaging for diagnosing lower back pain?
Absolutely. Typically, when we're evaluating a patient, sort of the go-to diagnostic imaging test, there's x-rays which show us alignment of the spine, but for the most part, it's an MRI. Now, and that shows us the soft tissues, the nerves, the muscles, the joints quite well. And we can determine if there's a nerve being compressed, or if there's swelling in the joints or bone around the discs. Some patients can do MRIs, some patients cannot do MRIs. If they can't, there's another modality that we can employ to really get a good look at their back. And that's called a myelogram. And sometimes we do order this test, especially if we want to get a weight-bearing perspective of how their back looks, because not infrequently when someone's lying on their back versus when they're standing, there can be some changes that we might not appreciate on the MRI. So, but the MRI is typically the go-to test to sort of give us a global look. And then if we feel like we need to get further imaging, we certainly have those options as well. There's other tests like a nuclear SPECT CT scan that can be employed sometimes whenever we're still unsure and we want to get a more sensitive test to look at the joints or see if there's inflammation that we just might not be picking up on MR or CT.
Thank you, Dr. Denning. All right, well, that wraps up our questions from the audience. We do have some that we didn't get to, and I apologize for that. There's so many of them, but I wanted to just turn back to the panelists and just ask for some final thoughts. So, Brandy, as a seasoned nurse, do you have any last words or advice to patients who might be suffering from back and neck pain?
Yes, I'd just like to say that, again, one of the many benefits of this program is that you will always have a nurse navigator. We're registered nurses. We're here to answer any questions that you may have. We're going to educate you on your procedures. And don't be afraid, just take the leap. We have made this process very simple and easy for patients to contact us and get scheduled. Let's see, if you'd like to schedule online, you have the option to do that. You can just go to our main website at bswhealth.com, click on specialties, orthopedics, and then just go to Back and Neck Center. You can chat with us online. We can get you scheduled that way. You can also call us directly. We're here Monday through Friday from 8 to 4:30. Our phone number directly is 469-814-2225. And we'll be more than happy to get you scheduled. And thank you all for your time. And thank you.
Thank you, Brandy. Thank you so much. Krista, any last words from you?
Yeah, so I think Brandy touched on our center and the multidisciplinary approach. And I think the thing I want to say most to patients and what I get from patients is when they have neck pain or back pain, they always think, oh my goodness, I'm going to need a surgery. And just letting them know that there's many conservative options out there. There's ways to look at your back pain and manage it without necessarily needing surgery, and that they can live with issues they may have in their back. They may hear they have arthritis or disc issues, and it's manageable. It's not something that's going to put them in their house for the rest of their lives. So definitely having the options for patients to deal with their back pain are out there, and it's getting better day by day.
Thank you, Krista. Dr. Ravula, any suggestions for folks that are experiencing pain at this point?
Sure. I think the way the center is set up, the interdisciplinary approach, it's a great way to make sure the patient is taken care of holistically. And our nurse navigators go out of their way to make sure the patient gets the appropriate care based on their condition and severity, so they don't fall through the cracks. So it's a great place to get started for a second opinion. And our team is here to help you all, and we have a very good setup.
Thank you. Thank you very much. Dr. Clark, any last words from you?
I think one of the beauties of this is that we really do take care of the whole person. And so we're not just doing medications, we're not just doing interventions or even surgery, but we want to take care of people in their whole lives so that they can cope better and have a better quality of life. And that's what I would like to help with.
Thank you so much, Dr. Clark. And Dr. Denning?
Yeah, I agree with all of that. I think just to reiterate, at the Back and Neck Center, this is a team effort, and you as the potential patient are the focus. Whatever your issue may be, whether it's the nurse navigators helping you, the physical therapist, neuropsychology, pain management, or even surgery, patients will come and a lot of times they get a sigh of relief when we tell them, you know what, you don't need surgery. But whatever it is that you require, just know that we'll see you through this journey, basically to get you back to doing the things that you want to do. That's our ultimate goal.
Thank you, Dr. Denny, and thank you all the panelists for being here. And as you can see, we operate like a full team, and we'd love to help you if you need that help. To schedule a video visit, all you need to do is click on the schedule and appointment tab, and that's located in the bottom left corner of your screen. And just remember, the Back and Neck Center provides quick and easy extended next day appointments. So, and even if you need a second opinion, we can get you in the next day. So we hope to help you and help you feel better. We hope that this was very informative for you, and we just so much appreciate you being here and attending. And again, thank you to all the panelists and to the audience for participating. Have a great day.